I'm Dr. Cheshta Agarwal, your dermatology educator. And today I got an opportunity to introduce you to an amazing student, Dr. Ritesh Kumar, who have scored 157 in the recent FMGE. So welcome, Ritesh.
Hello, ma'am. Good evening, ma'am.
Good evening. So first tell me, how are you feeling, Ritesh? I'm sure that, you cannot
Super
just
excited,
phrase them in
ma'am.
the words. Yeah.
Super excited, ma'am.
So can you just tell me a little bit about your journey, like, how you studied, from where you did your MBBS, and, like how you have spent time for studies and doing everything?
Yes, ma'am. I done my MBBS from Kyrgyzstan in 2022, and I came to DAMS in my second attempt when I am giving. And I used to study, ma'am, from only notes and DFX.
Okay. So how do you feel, Ritesh, that how the DFX and the DAMS notes have helped you in, reaching your goal?
Ma'am, it's gold standard, ma'am. DAMS DFX. Especially, ma'am, your subject, ma'am.
Okay. So that's very nice of you, Ritesh. And I think that's all of these students are telling, that the DFX and the notes, they were made in such a way that, it has helped a lot of students to crack the exam. So
Yes, ma'am.
what do you want to tell the other students, Ritesh, that what they should do, and, any specific things you did, like you have made some timetables, and anything you want to tell the students who are still trying for their exam?
Ma'am, firstly, before studying DFX, we should firstly cover our main notes, ma'am, minimum 1 or 2 times, ma'am.
Okay.
And after the DFX will be cakewalk, ma'am.
Okay. So like first you should be prepared yourself, and then you should revise using, DFX, so that whatever you have read, it will be a quick revision to it.
Ma'am, it should be for last 10 to 15 days only DFX.
Okay. So many students, they want to know that how many hours you used to study, and, because this is something which everybody look up to, that, like in a daytime, how many hours you used to study, what are your free
Ma'am,
time. So
we should not say, ma'am, means we should not take that we will study 12 hours, 13 hours, ma'am. If
okay.
your target is completed, if you
Yes.
are getting accuracy in question bank like say 60%, that's all for the day.
Yeah, so that's a very important and good thing which Ritesh has brought up, that you should stick to what you say. It may not be like 13 hours or not sleeping, just studying. It may not be that, but if you're doing it with time management, I think everything will be good and will be clear for all of you. I think that is,
Yes, ma'am.
yeah, that's a
No,
very good
with
message.
using stopwatch technique, we can manage our time, ma'am.
Yeah. So another important thing is, you can just time out your day. Like, like if so many hours you have to spend for studying, you can just put a timer. You can just study on that time. And just one question, Ritesh, like how many MCQs you used to do it on a daily basis, or like what about the DAMS DQB? You must have done the questions which are there on the
Yes,
app.
ma'am.
Yes. So
Ma'am, I used to do DQB in evening time, means after dinner after
okay.
7 o'clock, ma'am.
Okay.
1 to 2 hours, ma'am.
Okay. So in the
Mean
morning time, you used to
one
study.
or two custom modules, ma'am.
Okay. And like if there is any confusion, you just see the recorded
Video,
discussion of that.
ma'am, video solution, ma'am.
Yes. So I think a lot of informative message you have given to the students. And in the end, like just one thing I want to ask, how important were the PYQs, or I should say the previous year topics for your exam? Like what do you feel that was it important for anybody to clear their exam?
Ma'am, especially, ma'am, PYTs are more important than, ma'am, PYQs.
Yes. So
Because
again,
this
a
time,
very
ma'am, we feel, ma'am, surgery was on major chunk in one slot. So
okay.
we could revise, or we should revise surgery main notes till exam, ma'am.
Yes, definitely. So obviously the big subject, you have to revise everything. And I think almost all the questions were from the notes itself. That's what the other student have told. And,
Especially from OVG, ma'am.
yeah, OBGs were totally from the notes, DAMS notes. So
Yes, ma'am, totally, ma'am.
yeah.
OVG and PSM and your subject also, ma'am.
Okay. So very nice, Ritesh. And we are very happy. And I'm sure like you will be more happy, like,
Yes,
because
ma'am.
the exams are done and there was a big, like things going on with respect to the FMG, the NEET PG, the postponement and all. So I think that is
Yes,
a big
ma'am.
relax.
When I heard about NEET PG postponed, firstly I thought maybe also be postponed.
Yeah, I know. Like we also had that fear, like, because it was very unexpected. We were not expecting NEET PG to get postponed just a day before. And
12
obviously,
hours before, ma'am.
yeah. Chalo, that's a big thing, that one relief, one step is cleared.
Yes,
And I'm
ma'am.
very happy that you have scored very well. So thank you, Ritesh, for coming
Thank
up
you, ma'am.
and, sharing your preparation strategy with us. Thank you, and have a nice day.
Thank you, ma'am.